This is PHLV Radio Las Vegas, The Monitor, looking globally at the periscope of the latest situations amid the COVID-19 pandemic. PHLV Radio Las Vegas, The Monitor. Masaganang panonood po sa inyong lahat, mga kababayang walang kaba. Sa bahaging ito po ang paglilingkod bayan ng PHLV Radio Las Vegas. Ang mga membro po ng International League of Broadcasters ay minsan pang maghahatid po sa inyo ng mga kaalaman sa gitna po nitong masalantang COVID-19 pandemic. Ito po ang PHLV Radio Las Vegas, The Monitor. Bago pong lahat ay ipinakikilala po namin minsan pa muli ang mga members po naman ng International League of Broadcasters. Unahin po natin ang pinakabata from San Francisco Bay area. Walang iba kundi si Mr. Al Cabusas. Al?
Nakita niyo ako? Kita mo na ako? Nakita mo sa akong kagwapuhon?
All right.
I'm really honored, Rex and Bong, to be with you again. Well, this is the first time that I met Bong here. But as earlier, Rex told me who Bong was with him in broadcasting. Believe ako sa inyo. Ako hindi na ako believe sa aking sarili ngayon. Medyo alam mo naman yung magkabata tayo, hindi na tayo makita ang litra. Pero ang kagandahan nandiyan pa rin. Okay?
Of course.
So thank you, Rex, and to our listeners and broadcasters all over the world. Welcome to our PHLV Radio Monitor. Is that it? Is that the one, Rex?
That's the
Tama
one.
ba
That's
yun?
the one. The Monitor.
Okay.
Yeah.
All
Anyway,
right.
thank you. Thank you, Mr. Al Cabusas. Dati pong broadcaster ng Davao, Cebu, and different parts of Mindanao. Very, very professional. And ang pinakabata po sa grupo namin, bagong salta. Broadcaster din po from Cebu, and siya po ay nahuli ko sa Y101 FM bago po na-imbita ko si Bong Valentine, Neil Bongcaras, Bong Valentine, na sumabay sa akin sa DYBU FM. And please welcome and unang greeting po ni Neil Bongcaras as Bong Valentine ng DYBU FM, and now he is in West Covina as a nurse. Go ahead, Bong. Go ahead.
Yes. Good morning, good afternoon, good evening, wherever you may be following the Monitor. Nice meeting you, Al, and thank you for having me, Rex. Very thankful for this opportunity, and thank you for giving me the road to my life, sort of, in the radio broadcast industry. You gave birth, baptized me as Bong Valentine way back in 1988, and stayed with the radio station for 10 years. Fortunate enough to carry on what I've learned, even here in the States, working as a nurse. So it's nice to be around, Al, and to be around Rex. So thank you for having me on the Monitor.
My pleasure. And by the way, before na umalis si Bong sa Cebu, he was managing the word broadcasting of San Carlos, University of San Carlos, ang tinatawag namin sa Cebu as Spirit FM 89.1. Is it correct, Bong?
Yes.
Di ba? Wala pa din ko kalimot, no? Sa Cebu. Anyway,
ayaw ipakita yung pagkabatanon. Sige, okay.
Anyway, thank you. Sa mga sumusubaybay po naman sa The Monitor, malaki po ang kaligayahan namin na kami po ay inyong pinakikinggan at sinusundan every Tuesday at 6 o'clock, Wednesday, 6 o'clock p.m. Dito po naman sa Vegas, Nevada. And of course, lagi pong lumalagablab at nagliliyab ang The Monitor because of this COVID-19 pandemic. Unahin po natin ang mga situation report Galing po naman kay Mr. Al Dodong Cabusas of San Francisco Bay Area. Dong, go ahead.
Thank you, Rex. Now, anyway, the beautiful weather right now here in the Bay Area. When you said Bay Area, San Francisco, actually the 9 counties that touch San Francisco Bay Area are Alameda, we have Contra Costa, we have Marin County, we have the Napa, we have San Francisco, we have San Mateo, we have Santa Clara, we have Solano, and we have Sonoma counties.
Sonoma,
now, I
right.
belong to the Solano County area. Now, these 9 counties, ladies and gentlemen, include 101 cities, 101 cities, and then 7.4 million inhabitants, and approximately 7,000 square miles of land. That is the Bay Area.
Right.
And then our region is home to 3 major cities, San Francisco, San Jose, and Oakland. All right? The
And
Bay
you belong
Area,
to San Jose.
yeah,
Where you
the
belong?
Bay Area includes Silicon Valley, and
Silicon.
then a leading hub for high-tech innovation and development, and a big factor in predicting future Bay Area growth. Dito ang Apple, dito yung mga malalaking ano dito sa Bay Area. And the MTC collaborates with dozens of agencies and organizations to manage and maintain the transportation needs of people like you and the thousands of businesses that call the Bay Area home.
Right.
All right? So, yun po ang mga ano natin sa Bay Area, whatever is you think of the Bay Area.
Yeah.
Bago ako, by the way, I will not be staying too long here. After this message and after this short news that I will be giving to you, I will be leaving shortly because of some very important appointments. Okay,
Copy on
Dong
that.
and Bong, it's an honor for me to be with you again.
Same
Now,
here.
the San Francisco County officials announced today the city and county's stay-at-home orders will remain in effect through the end of May amidst a still growing number of COVID-19 cases across the Bay Area and state. The orders were previously set to expire May 3rd. Malayo pa. Oh,
May 3 pa,
malapit
ha?
pala.
May 3.
And then San Francisco, in tandem with 5 other Bay Area counties, as I said to you earlier, the Alameda, Contra Costa, Marin, San Mateo, and Santa Clara, announced extensions through May to the respective shelter-in-place orders. Now, the guidelines also include limited easing of specific restrictions for a small number of lower risk activities, but did not specify what those activities may be. Okay? Bong?
Okay.
And
Anyway.
Rex, your
Anyway,
turn.
how about the number of people who are going to the groceries and the supermarkets? Anong observation mo, Mr. Cabusas? Al, Dong, go ahead.
Well, let me just put this headphone. Looks like I'm not really hearing far. Okay, anyway.
No problem.
There are restrictions of okay, just like yesterday I went to Walmart. They said the Walmart is closed, but it's still open. The only problem we have right now with the groceries, with the restaurants, with the these Walmart stores, Costco, and all these other establishments. The only problem is when you, of course, it's still a worldwide problem and it's statewide. and here in the U.S. also, that the groceries are, when you go to the groceries or Walmart or Costco, there's a long line. As a matter of fact, before I go inside, I will check first if the line is long, then I don't go inside.
Natural. Maipit ka sa loob. Di ka na makakakilos. And how about the, I would say the pier? What's the development in the pier in the Bay Area? Do you have any news about people along the pier?
I have,
Yeah. Go ahead.
Yes, I have a lot of items which I was supposed to discuss with you, but I want to be specific with my statements and my report before I announce it to you guys. But there are a lot of new developments here in terms of, like, for example, the first coronavirus virus patients which were landed in Oakland, and there were about how many hundreds of tourists in that particular Princess cruise line. They were admitted here in the some kind of a Bay Area Army. I forgot the exact name of that, but recently they were already out of the hospitals or they are being quarantined, and they were sent back to their respective cities. So, but it does not, personally, ako magsabi sa inyo na at this point in time, I don't agree, personally lang yon, na hindi pa tayo dapat, for example, magbukas ng mga businesses, magbukas ng mga casino, magbukas, because, you know, I understand that New York right now is probably going down, but being New York is going down in their cases of coronavirus, I'm almost sure that some other cities all over the U.S. are experiencing higher cases already. So I don't agree personally that these things has to be done at this time. It's still not even proper to say a definite date to have this businesses or, you know, stores open.
That's
you know what I mean?
That's why Al in Nevada, specifically Governor Sasulak, he doesn't want to open the businesses here.
Correct.
And here's the mayor,
Yeah.
a lady, Mayor Goodman. She wants to open the businesses in Nevada or Las Vegas, but as of this time, medyo nagagawan pa sila ng ano ang dapat gagawin, because whenever tourists come and visit Las Vegas, Nevada, baka magdadala pa sila ng mga palagi natin COVID or any flu na galing sa San Francisco Bay. What do you think? Yun ang mga developments dito. Anyway, and this time, let's listen in back to California from San Francisco Bay Area. Let's go to West Covina with Neil Bong Valentine Bongcaras. Neil?
Thank you, Rex. And
thank you, Rex.
Al. From up north to down south, I am currently about 30 minutes east of downtown Los Angeles. That's where West Covina is. West Covina is a neighboring city to the other counties like Riverside, Orange, and San Bernardino. West Covina is still very much under the LA County. I'm currently working as a frontliner. I am running a Texas-based healthcare company here in West Covina. And we cover pretty much those areas, those counties that I mentioned earlier. I'm very much into what's going on with the COVID-19 cases here in Southern California. Being a healthcare professional myself, just recently, about 30 minutes ago, it was reported by the Board of Supervisors that they are trying to create a roadmap to reopen the business here in the LA County specifically. As of today, there were 29 deaths reported, bringing the total to 942 deaths for the LA County. and a total of 900 new cases just for today, bringing the total to 20,417 since the start of the pandemic. 92% of the deaths reported were people with underlying health condition. And fortunately, 400 plus of the reported deaths from the skilled nursing facilities. 45% of the deaths, actually, the total number of people who died from the coronavirus disease were skilled nursing facilities residents. And there's a big debate right now kasi ang nakikita ng mga health authorities na ang reason why there's an uptick in the deaths of these healthcare residents are due to the fact that the healthcare providers, the nurses, the LVNs, the CNAs, they're hopping from one facility to the other to augment whatever they're making. So, alam mo naman, gusto ng mga tao mag-overtime to make extra, extra money without knowing na they may be asymptomatic, but they're carrying the virus and introducing it to the older people with underlying health condition sa mga facilities. That's the sad part of what's going on. So right now, I think it was announced by the governor, Gavin Newsom, that he is already working together with the Los Angeles County supervisors and the LA City mayor that we're opening opportunities for healthcare professionals, both asymptomatic and symptomatic, to have themselves tested. So that's the latest in terms of the COVID situation here in Southern California. Plus, it's worth noting that the governor, in his press conference today, he was thinking of maybe rescinding the earlier pronouncement of opening the beaches, especially in the Orange County area. He was going over the pictures over the weekend because the weather was really conducive for beach, and so nakita niya na maraming tao pumunta sa mga public beaches, even though that the parkings are pretty much closed. So people still flock to the beach, and because of that, there were no social distancing observed, and some of them are not wearing masks. And people were asking, how can you enjoy the water with your masks on?
Anyway, thank you, Bong, for that. We'll be right back with you. Then,
Bong,
alam namin si... Yeah, go ahead, Al.
Rex, speaking of retirement facilities, well, I wasn't able to mention it here in the Northern California, in the Bay Area. Now, after I have retired. After I retired, I was because I am entertaining retirement facilities, about 14 of them, and after this coronavirus came out, the activity directors informed me that it will be the entertainment will be canceled at the moment. Now, right now, the retirement facilities who hired me to entertain these retired people, or the elderly people, not the retired people.
Singing, huh?
No, okay. Now, they informed me, they called me that by next month, or they have already put me back on schedule. I said, I am sorry, but not at the moment, because I am, as I said personally, I don't think all the facilities or it will be open very soon. No. So I was just mentioning about it since Bong mentioned about retirement facilities here who are really badly involved in the coronavirus.
And affected, especially the business and also the residents, of which we've been monitoring them too, kung sila ba healthy or medyo mahina na ang kanilang katawan. Kasi nakikita natin, guys, ladies and gentlemen, that not only in California but all over the states of USA, na maraming mga facilities and mga retirement homes ang apektado, and most of them talagang namatay, yumao. We cannot I would say masamang pakinggan yung namatay, di ba? Yumao na lang. Di ba?
Yeah.
Anyway.
That's right.
And on the other hand,
All right.
I think si Al Cabusas has a very important
I'm sorry, I was
appointment.
about to
And,
butt in.
yeah,
the
pamamaalam
phone
po.
right now
Last
is calling
few
me.
words.
Okay.
Yeah. Pamamaalam, Mr. Cabusas, please, para sa audience po natin.
All right.
Go ahead.
Thank you very much, everyone. Those who are listening to us worldwide, to Bong, to Rex, thank you again. Okay? See you.
All right.
Bye.
Anyway, balik po tayo kay Neil Bong Valentine Bongcaras. Kasi interesado kami malaan from your area, San Bernardino, likewise San Dimas, you're close to that area.
Very close.
Chino Hills, Diamond Bar, and West Covina. Go ahead, Bong. And Situationer.
That's the 60 freeway corridor, sort of.
Right.
Yeah, everybody is very aware of what's going on. The healthcare facilities are constantly bombarded with information from the leadership, from both the county supervisors, from the mayors, from the LA Department of Health Services. So everybody is aware and making sure that we follow strict, social distancing, infection control. I live in a very, should I say, area where maraming mga Filipinos and talagang greatly affected ang mga Filipinos, especially their way of lives. No, alam naman natin karamihan sa mga Filipino are Christians. They go to church every Sunday, but unfortunately for the past weeks, talagang stay at home lang sila, nanonood ng online mass. But majority of the Filipinos who are in the area are also in the healthcare industry. So alam naman natin na maraming mga opisina, maraming mga trabaho na unfortunately na cut off and na lay off yung mga tao, but not so in our area because majority of the Filipinos here work as a healthcare professional. And
Most
as you
of
know,
them.
the demand is very high. As
Very
a matter
high.
of fact, daming emails, daming text messages offering for jobs to RNs, LVNs, CNAs, any other healthcare disciplines, tawag natin, very much in high demand. So yun lang ang medyo difference. But everybody is conscious. Like I went to a grocery store yesterday, medyo marami compared to the Monday to Friday traffic. But everybody is aware, nagsusuot ng mga masks, wearing gloves and all that, and practicing physical and social distancing. The other neighboring cities here in West Covina are also on high alert, especially the Covina, which is a neighboring city of West Covina. Ang daming medyo 65 years old and above. Maraming tao na medyo may mga underlying health condition din. And as you know, yun ang unfortunately ang mataas yung taong mga nasawi because of COVID-19. That's pretty much the situation here in the West Covina and the surrounding areas, and majority of the counties that's neighboring LA County, San Bernardino, Orange County, and Riverside.
Has there been any news about developments dyan sa West Covina regarding brownouts or yung water supply? Has there been anything like that?
So far, none. In terms of power failure, none reported. In terms of the water supply, as a matter of fact, the past I think 3 weeks, medyo makulimlim yung weather and all that, and plus the constant rain. Yung earlier issue na talagang we were short on the water level for the winter and spring season,
Yes,
talagang nawala na sa radar yon kasi parang we had enough rain. As a matter of fact, some of the areas here close to the LA County areas and neighboring Riverside, may maraming mga 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 flower fields na all of a sudden nagsisprout
Right.
because of the rain. No,
Yeah.
unfortunately, people weren't able to go and enjoy because of the strict social distancing restrictions, sort of, from the authorities.
By the way, have you been have you been to the park in West Covina? Anong situation ng mga park dyan within the area? Go ahead.
Within the area, the parks are closed, but people still go there.
Talaga?
As long as they maintain a safe distance. But the parking area is totally cordoned, discouraging people from coming. So if you're a resident of the area, maybe you can go and take a few minutes hike, but that's it. You cannot drive your car because it's closed.
By the way, Bong, have you ever seen the presentation of Dr. J. Tan, tagadulho, patimadulho mo ginis Dr. Tan, and then he created a shield for the health workers. Tingali, if makahimo mo diha sa West Covina, susiha si Dr. J. Tan, kayo sa niya sa mga may laki diri sa Las Vegas, Nevada. Tingali maka-create mo diha and then maka-donate ang mga taga West Covina, and then you can share it to the health workers for free. Shield na siya, and then doon nindot tanawa. Tanawa ang this morning's PHLB Radio Magandang Morning Vegas Pinoy, because he was able to demonstrate how to do it, how to make the eye face shield para po sa mga health workers or frontliners. Go ahead.
Actually, I was able to monitor earlier, pero wa na ko na monitor ang the whole program. I saw that there's 4 of you, duha mong lalaki ug duhang babae. Previously, murag tulo raman siguro mo, but I wasn't able to delve into that portion of Dr. Tan. But I will definitely go back and check. I know people are really getting creative, especially for the healthcare workers after the news came out na short good og supply ang mga personal protective equipments, including the the face shield, goggles. Unfortunately, we don't have much of that. It's worth noting kay ako nampung ko yung mga nurses na go provide og care sa mga disadvantaged, disabled kids o mga elderly. They will really benefit from this because no matter how big the organization, kung why supply, wagi supply.
Right.
Anyway, unfortunately, kami dili may priority. Ang priority karon is the bedside nursing.
Right. And sa mga taga Luzon, I hope naintindihan niyo po yung mga Cebuano na words namin. And huwag kayo mag-alala. We will try our best to be in Tagalog. At least maintindihan niyo kami. And by the way, one thing, I'll text you, Bong, the Facebook account ni Dr. J. Tan, because he's been listening to DYBU FM during our time, especially when he was a student.
Okay.
And then he's now a professor dito po naman sa Las Vegas, Nevada.
Good to know.
Anyway, anyway, we will be doing some more of this, Bong, in your area while we are serving the Filipino people and the Asian community to inform everyone about anything about COVID-19. And after this COVID-19, the PHLB Radio Las Vegas, the monitor, will still go on because we have to inform our audience, our listeners, and viewers about anything that is happening all over the world. So most of us, we will be continuing our service to the Filipino people. And ang pangwakas na bilang po naman, ang pamamaalam ni Mr. Neil Bong Valentine Bongcaras.
Before that, Rex, I just want to personally say thank you for giving me the opportunity, not today, but the opportunity you gave me years ago as you
My
welcomed me
pleasure.
to the, Manila Broadcasting Company,
The pa-
DYPU, then way back in 1988.
the
That was the
passion.
break. That was the break that really created a big impact in my broadcasting career. Thank you. You, Attorney Ed Montilla, and of course my mentors, Y101, si Cesar Ditan or Johnny Kawa. Well,
Johnny
thank you
Kawa.
very much. Rex, it's really nice to see you and nice to see you do what you love doing. I can tell that you are back in your element. Once a broadcaster, always a broadcaster, and and
Mhm.
and and the feeling is I think mutual um, to all the broadcasters who ventured in a different industry. I, for one, being a broadcaster for close to 18 years, from Y101, DYBU, DYDW, and of course my stint with DYRF as a student reporter anchor for Campus Focus, then with Sherwin Iviota and
Yeah.
Julius de Riosa. Well,
Yeah.
thank you so much, and
Mhm.
hope this won't be the last. Feel free to reach out. We would love to give you information of what's going on here in West Covina and the surrounding
Mhm.
cities and counties in Southern California. Thank you
Yeah.
so much.
Bong Valentine, don't forget to mention and greet your co-employees. They're watching us today. DYBU.
Um, well, yes, thank you very much. I know Beline's or Belina, Beline's daughter. We used to work for the
Sarah.
same hospital at Torrance Memorial Medical Center. She works
Torrance.
for the yes, she works
Mhm.
for the OR. Well, I work for the home health. Si
Sarah.
Larissa, yes,
Mm.
si Sarah. Si Larissa, hi Reese, Alma, Alex Rilente, Manny Galicia, and other techs like Fernando Umpad, Bobby Casela, sila Raul Del Prado, ug uban pa sa itong mga kauban sa ona. It's really nice chatting with you, Rex, and connecting with them, and hopefully this won't be the last.
Don't forget Canada. She is also watching you and watching
Mafi,
us. Mafi Lianos
yes,
and Alma de
Mafi,
la Torre, of course. Yeah.
of course.
Anyway, at napanood po ninyo mga kaibigan ang pinakabuod na mga pangyayari sa iba't ibang sulok ng sanlibutan sa pamamagitan po naman ng PHLB Radio The Monitor. Inaasahan po namin na kami po sa PHLB Radio Vegas ay nakapagatid po sa kanila na mga impormasyon na makakatulong po sa lahat ng mga mamamayang Pilipino at ibang mga lahi sa Asia. Sa lahat po ng mga kababayang walang kaba, on the behalf of the International League of Broadcasters, ako po ang inyong abang lingkod, Rex Ricarte po lamang. Magbabalik po ang pakikipagpanayam natin sa mga miyembro ng International League of Broadcasters para po naman sa situational reports ng PHLB Radio Vegas, The Monitor, sa iilang saglit. Marami pong salamat.
Hello, guys. Good morning. This is Leo B from our workplace. The gentleman left to me, this is Reagan Velasquez.
Hey, guys.
Hey, you guys. We're people who are actually working out here at the emergency room in one of our hospitals here. I just want to say thank you for staying home and thank you for following all the directives to keep safe. Again, you guys are the frontliners. We are not. Frontline fight is out there, folks. As long as you guys stay well, we're gonna be okay. Say something.
Like Leo said, again, I just want to say thank you for everybody for doing your part as well. As you all know, this is not just us healthcare workers. This is everybody around us. This is a fight for everybody. And we just want to thank you for your support and continue what you guys are doing. Is really helping us out as far as our patient load here and as far as patient coming in here with the coronavirus. So it's really helping us a lot. So thank you so much.
All right, folks, take it easy out there, and thank you for listening to us. And PHLV Las Vegas, #1.
Stay safe.
This is PHLV Radio Las Vegas, The Monitor, looking globally at the periscope of the latest situations amid the COVID-19 pandemic. PHLB Radio Las Vegas, The Monitor.
Minsan pa po, mga kababayang walang kaba, masaganang panonood po sa PHLB Radio The Monitor. Sa pagkakataon po ito sa The Monitor ng PHLB, ang mga kasama po natin sa International League of Broadcasters na nanggagaling po naman sa Los Angeles, California. Panoorin po natin ang ulat ni Lenny Gomera. Lenny, come in.
Andito tayo sa likuran ng Seafood City entrance at Eagle Rock Mall here in Eagle Rock, Los Angeles, California, of course. And we are observing here social distancing. Each person or each customer has to stand on the designated line. They really put a line so that you can only stand there. You can go closer to the next person because of the mandated social distancing. And nakikita natin marami ng taong pumipila. Kinokontrol nila kung ilang tao lang nandun sa loob. So meron sila mga personal na nag-aabang outside, by the gate. They are offering disinfectant sprays. So if you have masks and gloves, that would be the best because you would be better protected. And but if you don't have, that's fine also. And they are just offering you disinfectant spray when you get in, and when also you get out, nag-offer din sila ng disinfectant spray if you would like to ask for it, So, tara na, pasok tayo. It says here, this is the temporary entrance. So, I'm going to get my cart now, and let's get inside, and we'll see kung it's been filled up already because 2 weeks ago, it's almost empty. Oh, wow. So now we can see that there's a lot of fish, almost all of the seafood products that has been sold here. We can still find it, and there's a lot of them, so we don't have to worry. We don't have to panic. At makikita natin dito yung mga tao na nagsha-shopping, they don't seem panic, but it's not as packed as before the crisis. So, dati, ang dami talagang tao nagsha-shopping dito. But now, limited na lang. And especially, they closed the mall. See, that's the entrance from the back. From the front when you pass by the mall. So, we can see a lot of filled in. The meat section, the fish section, chicken section, it's all filled up. So, wala na tayong worries na we will get hungry. So, the vegetable area na naman is also filled up. So, fruits, vegetables, tomatoes, lemons, we have the onions, potatoes. It's all filled up. And also here, the greens, it's all filled up. There's a lot that we can buy. And also last week, there's no more rice. So everybody's like crazy for rice. But now, there's still rice. So they don't run out of rice. But when you are going to buy, it's only limited 1 sack per person or per shopper. So last week, itong shelf na to is all gone. But now, it's all replenished. Those are the noodles. So, now, marami na tayong noodles. Marami na tayong makakain. Like almost everything that a Filipino market has, it's all filled up. No worries talaga.
Mga kababayang walang kaba, inyo pong napanood ang ulat ni Lenny Gomera na nagbubuhat pa naman sa Los Angeles, California. Member po naman ng International League of Broadcasters. Babalik po kami sa iilang saglit para po naman sa iba pang ulat galing sa Los Angeles, California in just a short while.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Minsan pa po na maghahatid ng mga ulat ang member ng International League of Broadcasters na nagbubuhat pa naman sa Los Angeles, California. Panoorin po natin ang ulat ni Kenneth Gold. Kenneth?
Salamat Rex Ricarte, sir. Ako po ay narito ngayon sa tabi ng concrete bridge at nasa kanto ng Temple Street at North Hoover Street sa Los Angeles, California. At nakikita natin dito na marami pa rin mga homeless ang nakatira sa ilalim ng bridge na ito at sa tapat din. At nakikita ko na may mga 10 na mga plastic tents ang sa loob dito sa ilalim ng bridge na ito. At nalalaman natin na marami ng mga homeless people ang binigyan ng gobyerno ng kanilang mga bahay o government facilities na doon sila pinatira. At ito na lang siguro ang ang ilan sa mga hindi pa nabigyan. So, yan po ang ating report ngayon sa kanto ng Temple Street at North Hoover Street, Los Angeles, California. Sapagkat nakikita natin dito, nakikita ko sa ibang mga lugar na kung saan ay maraming mga homeless people ay nawala na sila. At probably yun sila ang nalipat na sa government facilities. Pero meron pa rin naiiwan katulad dito. That is my report. Rex Ricarte, sir. Thank you. God bless.
Mga kababayang walang kaba, inyo pong napanood na napakinggan ang ulat buhat pa naman sa Los Angeles, California, particularmente malapit pa naman sa Beverly Boulevard at sa mga karatig po nito. Kasama po naman ang ating member ng International League of Broadcasters, si Kenneth Gold. Babalik pa kami sa ilang saglit. Kasama po natin ang ating member pa rin ng International League of Broadcasters from Maryland, Mr. Bong Aznar, after this.
Here are the top 10 things you can do if you think you might have coronavirus or COVID-19. 1. Stay home. 2. Monitor your symptoms carefully. If they worsen, call your healthcare provider. 3. Rest and stay hydrated. 4. If you have a medical appointment, call ahead and let them know you may have COVID-19. 5. If your symptoms are severe, call 911. 6. Cover your cough and sneezes. 7. Wash your hands often. 8. Stay away from others in your home. Use a separate bathroom. 9. Avoid sharing personal items. And 10. Clean all surfaces that are touched often. For more information on COVID-19, visit cdc.gov/COVID-19. Let's take care of ourselves and each other.
This is PHLV Radio Las Vegas, The Monitor, looking globally at the periscope of the latest situations amid the COVID-19 pandemic. PHLV Radio Las Vegas, The Monitor.
Mga kababayang walang kaba, minsan pa po bumabalik kami sa ikalawang singkad ng palatuntunang para po sa inyo, sa mga kababayan po nating walang kaba, ang The Monitor na pinaglilingkuran po naman ng iba't ibang miyembro ng International League of Broadcasters. Kanina, napanood po natin ang West Covina and San Francisco Bay. At dito pa naman tayo gumawi sa Maryland. Balik pa naman tayo kay Mr. Bong Aznar. Bong?
Hello. Good afternoon from I am. to everyone. I am,
And
I
go
am
ahead.
here in Maryland, and the Apodares County, San Maryland. They call it the Prince George's County. And this place where I am just a few hours to drive from Washington, D.C. These are my neighboring states. Not D.C., it's not a state anyway. Pero Washington, D.C., the state of Virginia, and also the state of Delaware. One is lang mga silingan ng mga states sa Maryland. So I can probably provide you some input from our end, especially in connection with sa kaning coronavirus. Yeah. I'd like also to thank Rex for having this program. So you can also help in propagating situationers to our friends and kababayans in other states of the USA.
Yeah. And by the way, Mr. Bong Aznar has been managing radio stations in Cebu, and he's been anchoring newscasts on RPN 9 and different nation or national television and radio in the Philippines. And he's Cebuano. And palagi ko nakapagtatagalog naman ng mga Cebuano. Bigyan mo kami ng update and the situationer Bong Aznar from your end. Go ahead.
From our side of America, the East Coast, by far, wala pa po schedule for the lifting of quarantine, especially in Washington, D.C., in Maryland, and Virginia. In fact, ang atong Maryland governor, si Larry Hogan, is very cautious in reopening his state after more confirmed deaths and hospitalizations were announced last weekend. And the other day, in connection with this coronavirus outbreak. And the governor also said that cases of deaths and hospitalization would likely increase when restrictions can be lifted. So very cautious ang atong state governor din sa Maryland. In his own words, he said, we are watching certain metrics and looking at the pattern of numbers before we make any kind of decision. So everything is going to be based on the numbers and the science. So money ang atong latest.
Have you been in touch with the Filipino community as far as Maryland, Virginia, and Washington, D.C. Are concerned?
No, I'm not actually very well connected with the Filipino community in this area. But there's one Filipino organization that I'm familiar with, but it's based in North Virginia. And this is the what we call, I forgot the name of the group, Heritage Foundation, something. Yeah. And it's run by Attorney Valera, a lawyer, an immigration lawyer. And there are times that they have big occasions that cover Virginia, Maryland, and D.C. Pero wa kay ko circulation ng grupo.
Anyway, nagpadala ka, Bong, last few days ago, a situationer in that area. I read it, but maybe you can relate it to the listeners and audience and viewers of the monitor through PHLB Radio Vegas. Go ahead.
Oh yeah, that was last week. I gave you a latest count of people hospitalized, number of deaths, number of those afflicted by the virus in Maryland. Kunyanya ko bago ron figures. As of this morning, we have about 36,000 plus cases of coronavirus.
36,000?
36,000. A little over 36,000, about 36,400 coronavirus diagnosed in the region of Maryland. And DC also reported something like 3,982 cases. And I mean, this 34,000 covers the region, meaning Maryland, Virginia, and Washington, D.C. But in Virginia alone, we have 19,487. No. In Maryland alone, it has 19,487. And
affected.
In Virginia, we have 13,036 confirmed cases. And at least 1,497 people with the virus have died, covering Virginia, Maryland, and Washington, D.C. Yeah. So muna ang latest count of those affected by the virus in this area. Sa Maryland, we have 3 counties that are the top counties with affliction. Number 1 is Prince George's County, where I belong. This is number 1 of the counties in Maryland. Has a big number of coronavirus cases. We have 5,263 cases here in Prince George's, followed by Montgomery County. Daghang sa mga Pinoy sa Montgomery County.
Right.
And it's 3,843. Sa Montgomery, we have a lot of Asians, Latinos, and Filipinos. And then the third one is Baltimore County. We have about 2,548.
But these areas are not affected, or they have also a problem in cases of coronavirus?
These are the top 3 counties.
Top three
counties affected by the coronavirus.
Wow.
Muna pinakadaghan sa ila.
Pinakadaghan.
Sa Maryland. Muna ang latest nagyatag figures sa Department of Health in Maryland. The governor keeps on reminding everyone we have to follow the protocol, wash your hands, use face masks, the social distancing. You have to follow it, but you can also help reduce the number.
Maybe we'll use the word spacing. Spacing.
Yeah.
Anyway. Right. Anyway, those are the update. And by the way, sa audience po natin and viewers, we work at home, and Bong Aznar and me, myself here, we are home zoned. Home zoned.
I've been in the house for the last 8 weeks.
Oh, boring na, no? Boring na, Bong. But you go, you visit the grocery for your supplies.
No, what we do now, because of this increase of affliction, we have just to make online call for
delivery.
Yeah,
for
Even
delivery.
if we have to go to a pharmacy, we just have to call and online
deliver
deliver it to us. kinahanglan is better to be safe than
Yep.
to be cautious rather than to be,
So I hope and your family are well, and yourself too, and your friends around in Maryland. Anyway, Bong, thank you sa update, and give us your parting words before we get off the air. Go ahead.
Yep. I just would like to suggest to everyone listening that if they can, please continue to apply caution all the time. Yeah. Don't ever think that coronavirus is only susceptible to the old or to the
The seniors.
the seniors, even teenagers, even teenagers, even kids, can avoid going out, stay at home. Para wala problema, and then we can settle the problem as soon as possible.
Would you like to greet your friends in Cebu, Bong, while we have the chance? Your friends in Cebu.
Yeah, I'd like to say hi to everyone, especially in Taga Cebu. Ang akong mga
Kedua sa basketball.
kaila sa basketball, mga kauban nato sa gawas. Yeah,
Si Arman Alforque is also watching.
si Arman Alforque, ang atong
attorney.
abogado. And naghantang mga kaila Cebu, pero I just forgot to mention some because Sam kalimot na mo gutagod ba?
Don't forget Attorney Chiking Ciares.
Oh, yeah, Chiking. The Big Four. Chiking.
The Big Four. The Big
And
Four.
we have Espinosa.
Yeah, Leo. Attorney. Attorney Eli.
Espinosa, yeah, we have Choi.
Toralba.
Toralba. And then, we have Bobby Nazaro. Yeah.
Right.
Eddie. Eddie, what's the last name?
Eddie who? Barita.
Eddie Barita, yeah. These are the guys we used to go to.
Yeah, I know.
On weekends,
And our trip to Singapore, remember? We enjoyed it. And then si Maning is also in Vegas.
Oh, yeah, Maning.
Sa Torre.
Yeah.
Yeah,
Maning
he's
sa
also in
Torre.
Vegas. Anyway, dito po naman nagwawakas mga kaibigan ang The Monitor. Kasama po natin si Mr. Bong Aznar ng RPN9, and he's been broadcasting for so many years sa Cebu. And of course, he broadcasts through television direct to Manila. And nagpapasalamat po kami kay Mr. Bong Aznar for joining us on the International League of Broadcasters. Para po naman sa PHLB Radio The Monitor, in behalf of Bong Aznar, ito po ang inyong abang lingkod sa Himpapawid sa The Monitor, Rex Ricarte po lamang. Thank you.
This is PHLV Radio Las Vegas, The Monitor, looking globally at the periscope of the latest situations amid the COVID-19 pandemic. PHLV Radio Las Vegas, The Monitor.